computer. Yeah.
Did you get my message about the who's doing what?
Yeah. I got that. Yeah. Wait, let me just keep that up because I didn't memorize it. Yeah. Okay. Cool. Ready? I'm gonna let everyone in.
Okay. Hello everyone. If we could ask you just to keep yourselves muted for now, just so we don't get an echo.
Okay, Shivas, if you want to start.
Yeah, sure. Okay, so hello everyone and welcome back to the Medical Debate, session 27. Today we're going to be talking about religion and medicine, which is something we've wanted to do for a while, and I think it's really interesting and particularly relevant today. So yeah, we're going to make a start. And we've got a question here on the screen, just kind of as a starter. What do religion and medicine have in common? What are the aims of both, and why is there kind of an overlap between them, and then also why might they come into conflict? So if you have any just initial ideas surrounding the topic, please do put them in the chat. So we've already got someone saying ethics, and yeah, I think that's quite important. I think ethics is a central part of both religion and medicine, considering many religions have their own kind of ethical standards and ethical kind of principles, and you've added upholding morals as well. Yeah, and I think a large part of both religion and medicine is doing what's morally right. Someone else has put, they both provide hope, and actually I think that's quite interesting. They both kind of have the purpose of, helping people improve themselves perhaps, and yeah, kind of providing a meaning or hope to people. So yeah, that's very interesting. Any other ideas? No? Okay, well, I think you've kind of covered, the main ones. There isn't really a right answer here, but yeah, I think morals, ethical principles, they're kind of the main things, and also perhaps just helping people, helping the community. That's kind of an important part of both religion and medicine. Healthcare professionals have the purpose, have the aim of providing support to other people. That's their job. And in religion, often, many religions kind of emphasize helping others. Yeah. So we're going to move on now and talk about our first case study, which is Jehovah's Witnesses. I'm sure lots of you will have heard of them. They're a subgroup of Christians. And this is a quote from the Bible, which obviously is the main religious book for Christians. Just be firmly resolved, but do not eat the blood, because the blood is the life, and you must not eat the life with the flesh. And this kind of, links to the idea of blood. Blood was seen as very important in Christianity, and especially, Jesus's blood. There was a lot of symbolism surrounding that. And this quote from Deuteronomy 12:23 is kind of what Jehovah's Witnesses use to justify not accepting blood transfusions, because it's seen as kind of eating blood, I guess. And this is just their interpretation of this quote. And, therefore, they don't accept blood from a donor to be transfused into them. And that being said, blood transfusions are generally very safe, and they're performed when a patient has lost a lot of blood, or if they have a blood-related condition, leukemia, for example, and certain chemotherapies as well. It affects blood cells, and therefore blood transfusions are required. But Jehovah's Witnesses usually don't accept them. So we've got a little example here, which is a real life case from 2004. A 36-year-old called Angela Shipley experienced severe complications after the premature birth of her son by cesarean section. Although she was seriously ill, she persistently refused to accept a blood transfusion. And doctors did obviously attempt to find various drugs which could be used to treat her instead, certain alternative treatments, but they weren't able to treat her condition, and she did die soon after. But after this whole situation, many doctors did say that they thought her life could have been saved had she accepted the transfusion, because when she said no, the doctors had to kind of scramble to find the right drugs. And I was reading an article about this. There was a lot of confusion over which drugs are being given to her, and the whole situation was quite difficult. Therefore, we've got a question here. Firstly, who is responsible for Angela's death? Was it the doctor's fault? Was it their place to intervene, or should they have rightfully respected the choice of the patient, even if it meant that there was a risk of them dying? And then also, should doctors ever be allowed to override a patient's decision? And especially thinking about autonomy here, I think that's the main principle. And also, what ethical issues could this lead to if a doctor does override a patient's decision? So yeah, please do put your answers in the chat. And yeah, it will be interesting to see what you think. So we've got someone saying no one was responsible due to autonomy. We must respect their decision. And yeah, that's kind of the principal value of what the NHS does, and which is why in this case, the patient's autonomy was respected, and therefore they weren't given a blood transfusion. You've said in some cases we can follow the doctrine of necessity and provide treatment and override the patient's decision under that doctrine. That's interesting. But yeah, in this case, you could argue that it was necessary for the patient to have a transfusion to save their life, and perhaps that the doctor was, responsible for that death, and because it's their duty to care for a patient, to provide, help to a patient, treat them, and help them recover, which they possibly didn't do in this case. You put, would doctors be able to override when a patient doesn't have the mental capacity to make their own decisions and no family is present at the moment of decision? Right, well, we have talked about this before, and it's to do with kind of competence and whether a patient is, able to make decisions about their treatment by themselves. And if they're not, then often the family is asked. But in this case, I don't believe there were, I don't think it came down to competence, because the patient was deemed competent. It's just that they refused to have treatment based on their religion. So I don't think you could argue that they didn't have the mental capacity to make their decision here, because they did. They just didn't want to have the treatment due to the fact that their religion didn't allow it. Someone's put, in the best interests of the patient and following beneficence, we would provide treatment. However, sometimes going against the patient's wishes does more harm than good, weighing upon non-maleficence and beneficence, and certainly autonomy as well. Yeah, that's true. And it's important to note that even though, a doctor might recommend a treatment which might, clinically have the best outcome for the patient, might physically help them recover the best, sometimes that's not what the patient wants. And you've got to remember that, that could lead to, mental issues and, discomfort and a lack of trust for doctors as well. The whole, healthcare system in this country is based around trust from a doctor to a patient and vice versa. And therefore, if patients do not, if their wishes for what is happening to their own body is not respected, then, that kind of breaks that trust. And that's why autonomy is so important and why it's a medical pillar. Someone else has put, if us doing a blood transfusion may cause the patient even more suffering due to the religious beliefs, that would also be doing harm, not going along with beneficence. That's true. Yeah, that's kind of what we were talking about. If it's their religion and they want to follow that, then disobeying that can lead to even more issues. Like they might not personally believe that they will go to heaven, or they may feel that they've kind of not fulfilled their duty as a Christian or as a Jehovah's Witness. And religion is very important to a lot of people. Most of the world is religious, and that could lead to issues further down the line, being accepted within their own community. and that kind of thing. So yeah, you do have to look at both sides of the argument, and that's why religion does have to be taken into account here. We've also got, she could have been very distressed after the blood transfusion if the doctors overrode her decision. Even though her best interest was at heart, she would develop mental illness. Yeah, exactly what we've just talked about. Yeah, so I think we've had a very interesting discussion here. And we're going to move on now and talk a bit about death. So Siddhant, if you could lead this one.
Yeah.
So
So sorry, so someone just put in the chat, have to make sure if the doctor had equipped the patient with enough knowledge for and against the transfusion. Yeah, so as Shivas mentioned, that's basically an informed decision where the patient needs to, we talked about this in a previous session called informed consent, that before you take consent from someone, the only way that consent is actually valid is if you know that they made an informed decision, they knew all the pros and the cons. So yeah, well done, good point. Okay, so we're just going to talk about what is death, and we have covered this before, but I think it's quite an important topic, and so it's worth going over again. So there is no one definition fits all universal definition of death, but it is important that organs are not only taken from a patient after they have been confirmed by a doctor to be dead. In different countries, organs can be harvested after the following incidences. So one definition of death is brain death. So this is the cessation of all brain functions. Basically, your brain stops working. And in the UK, that's how the medical system defines a person has deceased or is deceased. This is the easiest to diagnose because the brain effectively completely shuts down, which means all your functions stop. The blood flow doesn't work. Your motor skills are zero because the brain obviously controls all your activities. There's no sensations. There's nothing sensory going on. And once the patient has been deemed sensory sort of unresponsive, and they can't perform reflex actions, which are the core pillar of the central nervous system, then they are declared dead. The second, a second definition of death is higher brain death, which basically means that it's the irreversible loss of function of the neocortex, which is basically the part of the cerebral cortex, which is the outer fleshy part of the brain, which is responsible for consciousness, memory, personality, and perception. So the higher brain functions. In this definition, a person can be declared dead even if other parts of the brain are still functioning. So this definition defines patients in a vegetative state as dead. Some, for example, patients that might be in a coma, they could be defined as dead with this definition. Someone's written in that, sorry, before I carry on, someone in the comments has written, does brain death involve person going into coma? Yes, so we just talked about that. It depends on your definition of death. If it's in the first one, then no. Then in the definition that the UK uses, then no. Someone in a coma would be considered alive, just unfortunately they are in a coma, and so they don't really have any higher brain function. In the second definition, however, it would mean that someone in coma would be defined as dead, but I don't know where this the higher brain death definition of death is actually used, but in the UK that would be considered as alive. And the third type of death is non-heart beating death, which is self-explanatory, where the heart stops beating. So if it stopped beating and the brain still shows function, they are deceased, and this is the definition in this case. After a waiting period, a check is required to make sure cardiopulmonary function does not spontaneously return, which basically means that they periodically check the heart to make sure that there's no miracle or they miss something and the heart starts working again, because obviously you don't want to declare someone dead when they were when they had something temporarily, they had some heart problem and it stopped, but it restarted later. And it is also possible for a patient to experience pain and perform reflexes. Now, I was going to say why that is, but can anyone sort of suggest why that is, why they could still experience pain or they could still perform reflexes even though the heart stopped beating? If you guys have any ideas, could you put them in the chat? Think about the other definitions of death and what we've talked about and what the why that. Yes, exactly. So the neurological system is still intact and functioning. The CNS is working and the brain is not dead. Really well done, everyone. So the CNS is actually the thing that is required for your reflex arcs. And I'm sure you guys learned this in biology, but the motor neurons and the relay neurons, they all connect to the CNS, the spine and the spinal cord, and your brain and the central nervous system. They could experience sensory sensations. Yes, they could. If the brain is still working, then technically, yes, they can. And in this definition, then, as you can see, there are pros and cons to every definition. And, you might not agree with a certain definition, but these are the three main definitions. Okay, so as we discussed, by UK law, brain death, the first one we saw, is the accepted definition of death. Organ donation is permitted beyond this point. So once someone has been confirmed to be brain dead, then you can perform organ donation and you can take out the organs and donate them. Certain people, including certain religions such as Christians and Buddhists, may believe that only cardiorespiratory death or non-beating heart death should be classified as death. Like we said, the definition of death is actually up for discussion, and so some religions, apparently like Christians and Buddhists, do believe that it's non-beating heart death that counts. And this links to the idea of the heart being the soul of the body that we discussed earlier. So this is a case study. One of your patients, Aryan, age 22, has suffered a stroke and is currently on a life support machine. Okay, before I continue, I'm just going to answer the question. Is it not possible to donate your brain in the UK then? Sorry?
I don't think you can donate your brain. I don't think that's really something that is possible yet.
Because that would mean surely that you change completely. Your personality would change.
Well, I don't think it's really been done before. I think, yeah. So I think
I'm not entirely sure about that.
Yeah.
We will do some research and get back to you next session if you remind us. Oh, you heard about some research in that? Okay. Well,
possibly some research. Yeah. But I don't think it's really been done. And if it were, yeah, okay.
Yeah, someone said, guess you can donate it for scientific research, though. Yeah, I'm sure you can donate, but people who can donate their brains for research. I mean, I think that's a widely known fact that you can donate it. But I'm not widely knowledgeable in this, but I don't think you can perform brain donations to another person as a normal organ donation. Anyway, Aryan, age 22, has suffered a stroke and is currently on a life support machine. While I'm reading the rest of this, can anyone define the difference between a stroke and a heart attack? Just something to think about. He has expressed that he wishes to donate his organs after death. After a few hours, you determine that his brainstem has become damaged, and therefore, if he were to wake up, Aryan would not be able to carry out vital functions. Therefore, he is legally dead. However, his heart is still showing faint signs of activity. You explain to his parents that the best decision would be to turn off Aryan's life support. However, his parents are devout Buddhists and tell you that they will not accept his death until his heart has completely stopped, because as you can see in the top paragraph, they believe that non-beating heart death should be classified as death, or some Buddhists believe that. And despite this, many of Aryan's organs have completely lost their blood supply already, and the window for harvesting his organs is closing quickly. Remember, guys, you only have a window of opportunity before the organs start sort of dying out. So it's, there has to be quite quick. We discussed this in a previous topic. And you tell the parents again that if his organs are to be donated, life support must be turned off now. What do you do? Right. So I did ask a question at the beginning. What's the difference between stroke and a heart attack? And I just want to see what you guys came up with. A stroke is when a blood clot in neurons causes blockage to the brain's blood supply. Therefore, there's a lack of oxygen to the blood, to the brain, sorry. A heart attack is basically the same, but the clot happens in coronary arteries. A stroke is when oxygenated blood isn't reaching the brain. Yes, exactly. Well done. So they are quite similar, but basically it's when a clot forms and or the walls of the artery, maybe because of fatty tissue or cholesterol, they become clogged. So there's the lumen of the blood vessel is too thin for the oxygenated blood to go to the brain or to the heart. Now, when it's too narrow for the oxygenated blood to go to the brain, that is called a stroke. And that's why you might see that in a stroke, sometimes you might have heard that the left side of your body starts hurting, or like one side of the face starts sort of drooping, but the other one's completely fine. Whereas in a heart attack, it's to the heart that the blood vessels, the lumen has constricted because of maybe a buildup of fatty tissues such as cholesterol, and therefore oxygenated blood is not reaching the heart, which again, you need oxygen because it's a muscle, and so it needs to respire. Anyway, so Now, moving on from that, guys, can anyone tell me what you would do in this case? So let's give you guys a few minutes to read over the case study. Think about what you would do in this case where someone has suffered a stroke and there are two conflicting definitions of death. So anyone have any ideas? Feel free to put your answers in the chat, or if you guys would like, you can raise your hands and we will pick on you and you guys can talk out loud. I know it's a difficult question. Of his parents to divide, but his not take him to death until his heart's completely stopped. If you guys can't answer that question, maybe it's a bit difficult, then try thinking about different things like, oh, someone has said, the family should be able to decide what happens. Okay, yeah, that's an ethical view. So because Aryan is age 22, so the concept of like parental consent does not really matter here. But yes, the family should be able to decide because, you know, he is part of the family, and you know, the different types of deaths matter to the family. You either listen to Aryan's wishes or his parents. Maybe you wait till the very last minute, but shouldn't autonomy win? Yes, that's right. So autonomy is one of the key four principles of the of medical ethics. And so if Aryan made a decision and he was competent when he made the decision and it was clearly documented that he made this decision, then his decision should be followed. And you cannot override his decision if he made it legally and competently, because that would be a breach of medical ethics. So that's a good point. In the best interest of the patient and in order to reduce suffering, the doctors believe it is more beneficial to turn off the machine, and this allows beneficence. In the situation, the ethical pillars reach conflict because this would go against the autonomy that the parents have and does not entirely respect their decision. This can cause a lack of trust in the profession. This links to the Charlie Gard case where the patient's parents have a different opinion to the professional. Okay, so that's a really, really thorough explanation of the different facts of the case. And I think that's a really good summary of it. I'm just wondering, Shiva, sorry.
Yeah.
Did Aryan give any decisions like what he wanted to happen?
Well, I would assume that he'd said he wanted to, you know, donate his organs.
Okay. And do you know?
Yes, we've got here in the second line. He's expressed that he wishes to donate his organs after death.
Yes, and did Aryan believe that death was caused by non-beating heart death, or?
Oh, I see. Yeah. So, I mean, we don't know. We haven't been given that information in the extract. But you know, I guess it would be different in those, you know, in different cases. If Aryan perhaps wasn't so religious, and therefore he believed that it was, you know, brain death counted as death, or he accepted the kind of UK law surrounding it, then, you know, perhaps he would have allowed himself to have his organs donated. But he's, you know, suffered a stroke and he's obviously very young, so I don't think he would have possibly thought about this at his age. So, you know, it's always difficult to tell. But, you know, in this case, you would possibly have to listen to what the parents, you know, think as well. But then again, there is a legal definition of death in the UK, and therefore legally he is dead, regardless of, you know, what other people believe here.
Yeah. And actually, Shivas made a good point there that legally he is dead. And but if you read the extract, it says his heart still shows faint signs of activity, which means that you know, if they were to perform an organ donation, his heart would actually be really valuable because it's working in optimum condition even after the legal definition of death. So at what point would you decide to wait? In which case the condition of the heart could deteriorate, or would you go for it? And actually, there's no answer to this question. I mean, legally, the brain death is death, and you know, we don't know exactly what would happen in this scenario. But I think it's very important to look at the different sides, and especially empathetically, as doctors should practice empathy. It's very important to realize that both sides have very reasonable arguments here, and you know, the professional is trained for years on end and been told a legal definition of death, whereas the parents, you know, they're devout Buddhists and religion and their opinion matters even more. So not even more, but just as much as the doctor, and possibly even more. You know, it depends. yes, so someone said following the legal donation, his organ should be donated. Exactly. So it depends what you're conforming to. I think they would have to conform to the legal definition. But again, I'm not entirely sure about that. Not following legal guidelines could lead to a slippery slope. Yes, you don't want to set precedent for breaking the law, but I think Shivas, correct me if I'm wrong, but in this scenario, they would have to follow the legal standards. But it is important to respect each person's religious and ethical views.
Yeah, although I don't know exactly what would happen in this case, but considering the fact that he is dead and he's expressed he wants to donate his organs, then I think that is what would have to happen in this situation. Just because the parents want to keep him on life support, if there is no possibility of him being able to kind of recover, and if his brain can't carry out any function, if he's not able to respond to anything, then I think they would make the decision to not keep him on life support, because obviously we've talked about medical resources in the past as well, and the fact that that life support machines are not in the supply of them is limited. So I think in this situation, what would happen if he's requested to donate his organs, that is what would have to happen in this case, because a life support machine could in theory keep a heart beating for a long time after even after the brain is deemed dead. So yeah, it's tricky to understand what would happen here. But yeah, unless anyone has any more points, should we move on? Yeah. Okay. Right. So the next thing we're going to talk about is whether religion can be a substitute for healthcare, or possibly a complement to it as well. So this is quite a comical example, I think, but it's one which is surprisingly common. And it's about, I'll just read it out. One of your patients, Dominic, age 60, comes into your hospital complaining of chest pains, and you diagnose him with a minor lung infection, which can be treated using antibiotics. However, Dominic insists that he does not need antibiotics and instead assures you that praying to God will help him overcome his illness. You tell him that if he does not receive antibiotics, his condition could worsen, possibly leading to permanent lung damage and breathing difficulties. However, he insists that he does not need the treatment and decides to discharge himself and leave the hospital. So firstly, we want to ask you what you do in this situation. And then there's also another kind of, there's a few studies surrounding the influence of religion and, recovery, patient recovery. And one that I was reading about was about depression, and the fact that patients who did have depression were able to recover quicker and more easily, if they were religious, because they felt that their faith gave them a goal and a meaning, something to strive towards. So, does that mean religion can count as a kind of a form of healthcare, as a valid kind of substitute for healthcare, or something which can aid healthcare? And also, some people might argue that it's not religion itself, it's more kind of like the placebo effect, that you kind of, if you believe that praying will help you get better, then perhaps you will get better, you'll feel more motivated and able to recover. So do you think that religion could be a valid substitute for healthcare or a complement to it? I want to see your ideas in the chat. And also, what would you do in this situation if you were the doctor and you were treating Dominic? Is it your duty to kind of force him to take the antibiotics? Or, is it okay for you to accept his decision? Right. So yes, so someone has put it could have a strong placebo effect, is what we were talking about. Someone has put just religion. I wonder if you could expand a bit more on that. Do you mean that religion kind of could be classed as a valid kind of form of healthcare? Someone else has put, I think it's important we do not dismiss their religious beliefs. We must advise the patient, comments. We must advise the patient of the benefits and risks of not taking the antibiotics so they can make an informed decision, and then respect autonomy. If they do not wish to take it, we have a duty of care to respect their decision. Right, and that's exactly what would have to happen in this situation. You would advise them about what to do. You would explain that antibiotics, not taking them could lead to, potentially serious health complications. and that you could tell them that praying might not be so effective, perhaps, if you look at it from a scientific perspective. Obviously, as we'll talk about later, it is also a doctor's duty to respect all patients, regardless of their religious belief. Religion is a protected characteristic, and therefore, you're right. The doctor shouldn't dismiss their religious beliefs. They should not say, no, God doesn't exist. God can't help you here, etc. Because that's quite offensive, I think. And it's important to accept people regardless of what their beliefs are. But I think, you would kind of tell them that, it's been proven that antibiotics can be very effective at treating this, and therefore, it would be helpful. And perhaps you could also say that, you can take antibiotics and also pray to God as well, if you believe that will help you. So there are a variety of different pathways you could go down here. But you're right, you would have to respect their decision regardless. Someone else has put beneficence and non-maleficence. As a doctor, we need to think of his best interest and try to explain to him the positives of taking antibiotics as much as possible. Yeah, that's what we've talked about. However, autonomy really might win because it is his decision and his belief and faith. The doctor can't change that. And saying praying isn't going to help probably won't help him because he will just get really upset that you are going against his belief. Yeah, and that's what we've talked about. It's offensive, and also, again, it could lead to other problems further down the line. If you're thinking, if you're telling him his religion isn't valid, that could potentially lead to even more complications, particularly like mental stress and that kind of thing. Someone else has put, there's no religious reason that Dominic cannot accept treatment and still pray, but it must be a consensual choice, and thus you should inform and advise him and maybe ask someone within his religious community to do so as well. Yeah, that's an interesting point, and I think that's kind of what puts this argument, what makes this kind of case study different to the one about Jehovah's Witnesses. With Jehovah's Witnesses, it's quite clear that they're not allowed to have blood transfusions, but here, there, as far as we know, there is no kind of religious reason as to why he can't take antibiotics. It's just the fact that he believes praying is a valid substitute for that, even though perhaps there isn't evidence to support that. But yeah, I think that's a good point. Someone else has put, not to undermine the nature of religion, but similar to what I said, the placebo effect can actually work. However, doctors shouldn't be lazy and still try to get them on medicine if they feel necessary. Yeah, and also, I think you've got to be careful here, because if you're just saying, religion is the placebo effect, if you're saying praying is the placebo effect, then that's also kind of dismissive of religion, by saying it's not actually real, it's kind of just something in your head that's making you improve yourself, kind of providing a scientific explanation for religion, when in fact, many religious people like to think of religion as something beyond science. Yeah, someone else has put, having a religion or a faith can help some patients in the recovery process, as treatment should look at all aspects, including those with spiritual beliefs. Yeah, a treatment should, yeah, and I agree with you. I think that religion can be important for some patients, and it's important to respect that. And I think personally the best solution here would be to provide treatment in conjunction with, allowing him to continue to follow his religion. You put, I think that religion can be a complement to healthcare, given that this is not forced upon patients and only provided when they feel comfortable with it. Yeah, I agree. Although, obviously a doctor would not say, they would not diagnose a patient and then say, oh, you should pray. Obviously that isn't something a doctor would do, because firstly, a doctor is not supposed to express their religious beliefs to a patient, and also praying doesn't itself have a kind of scientific basis behind it, and therefore, medicine is meant to be quite separate from that. I mean, it's meant to be kind of just scientifically proven treatments which are supposed to be given to patients. We've got lots of comments here, and I think lots of them are quite similar in what they're saying. Yeah, okay, someone has put, if you have mutual religious beliefs or an understanding of their beliefs, you could suggest, for example, that one must take care of the body that God has given them, and taking antibiotics, regularly checking up with the hospital is also part of taking care of your body. Right, that's an interesting idea. Although, again, I think a doctor wouldn't be able to express their religious beliefs here, but, a doctor might ask someone who is a member of their religious community to kind of help them understand how taking antibiotics could do, as you say, it could help them take care of their body, which is kind of what God would want, perhaps. Right. But religion can be another form of social prescribing. That's interesting. And I think, similar to a way a doctor might say, go and, make lots of friends or go out and socialize with other people. Although that's not really a medical treatment as such, it can be helpful for people and, in their recovery process. And similarly, a doctor might say to a patient, if religion is something which gives you a goal and a focus, that it might be helpful to sit down and pray or meditate or something like that. So yeah, we've got lots and lots of comments here. Someone's asked, can doctors express their religious views to a patient of the same religion? We will talk about that a bit later, but generally a doctor isn't, a doctor is allowed to express their religion in the sense that, for example, if, a doctor who was Muslim might wear a headscarf or, a hijab or something, or a Christian doctor might wear a cross or something. They're allowed to follow their own religion. Of course they are, but they shouldn't let their religion influence, their treatment. They shouldn't, for example, to do with abortion, some religions are against abortion, and therefore some doctors may be uncomfortable with carrying out abortions, but a doctor should never say to a patient, oh, you shouldn't do this because it's immoral or something. The doctor is supposed to be neutral in that sense. You've put, for example, I'll pray to you in my own time. And that's interesting. I don't know the exact rules around that, but perhaps, yeah, I suppose if it doesn't really have any direct influence on their treatment, or you're not directly telling them to do something because of religion, then I suppose it could be allowed, yeah. Yeah, so that's a really interesting discussion we've had here. I think we'll move on now. So yeah, Siddhant, if you do the next bit.
Yeah, so we're going to talk about drug production, and for many Hindus and Sikhs, killing animals, especially cows, is considered immoral. As such, followers of these religions often do not use drugs, implants, or dressings which contain bovine products. Many Muslims also do not use drugs or products which contain ingredients derived from pork. And this can actually present a problem ethically, because some drugs may be produced from these, but then, this can conflict with their religion. And that's a really big problem. And that can cause some problems, as we're about to see.
Sorry, just
Thank you. So a hypothetical COVID-19 vaccine contains beef and pork products. It was also tested on mice during preclinical trials. As such, many Hindus, Sikhs, and Muslims are opposed to taking the vaccine. Is it ethical for these people to refuse to take the vaccine? If you put your answers in the chat, guys, just have a think about this. Think about, if they didn't take it, right, how many people would be, how many people would potentially not be vaccinated? Think about, what could the effects of this be? Think about, let's say if they didn't take it, right? Think about herd immunity. Do you think that herd immunity would still exist? Yes, I believe we should respect their autonomy and try and find an alternative solution. Yes, I think that's a really good answer, because I think we should always respect everyone's religions and any ethical views they have. You might not agree with them, but you always have to respect them. And I think that it's completely reasonable for people to be religious and to conform to their religion when things like this happen. And people do tend, some people tend to believe more in religion when there's times of crises. Is this made from the rumor that the Pfizer vaccine is made from pig products? I'm not sure about this. Is
actually,
it?
I don't believe, I did research this. Right now, I don't believe there are any COVID vaccines which do contain animal products. Like you say, it's probably just a rumor. This is, as I put, a hypothetical vaccine. I just decided to make it a COVID one because, it's obviously quite topical. But there have been vaccines in the past which have contained animal products, including beef and pork products. But you've got to remember as well, there isn't a particularly large it's obviously very trace amounts of these products in these vaccines. But yeah, I wouldn't. Yeah, you should probably do a bit more research around that, because I don't know what if the Pfizer vaccine does contain pig products.
But that's a
But I
really
think,
interesting point, actually, that you've raised. That is this from the rumor, because then other people might believe that these vaccines might be made from these products, and if they're not, for example, but people have doubt in their minds that they are, then what does that mean? Could that affect our safety? And is it right for where did these rumors come from? And is it right for these rumors to spread if they're true, if they're untrue? I think it depends how much you sinning and putting other people's lives at risk. Hindus, Sikhs, and Muslims would be sinning by taking the vaccine, which could greatly impact their lives and the surrounding community as well, which could be argued to be on the same level as putting other people's lives at risk. Going against their wishes could also undermine the trust the public has in the profession, and this can lead to complications in their health. Yes, so I think those points are both correct. You should not go against someone's beliefs, especially when they're religious beliefs. And I know for a fact that for Hindus, cows and killing animals in general, in fact, especially cows, is seen as really, really bad. So going against such a sacred belief, and the same with Islam and eating pork, and going against these key beliefs that people have, regardless of your opinion, is completely fundamentally wrong and flawed. And you should always, always support people's beliefs, always, always, always support people's religions, and appreciate that they have their own views. And so I completely agree that forcing people to take vaccines, even if if they're religiously against it, is a very, very bad thing to do, to force them to take these vaccines. And so it's, like you guys said, is it ethical for people to force? So is it ethical for these people to refuse to take the vaccine? Yes, it is. And as you guys said, it's unethical, highly unethical, to force people to take them.
yeah, and we've got, I think, a very good comment here about how you've put. I think it depends on how much you, about sinning. And you've argued that if they do take the vaccine, if these religions do take the vaccine, then it would greatly impact their own lives and their own community and their own values that and kind of ideals that they have due to their religion, and therefore it would be greatly impacting their own lives, as well as the fact that if they did take it, then it would impact other people's as well. So yeah, and yeah, someone's put it can undermine the trust the public has in the profession. This can lead to complications in their health. Yeah, as we've mentioned before, trust is a central part to the NHS and our healthcare system in general. Someone's put, what if they are punished because of it, e.g. they can't get a certain job or can't travel? Should they pay the price? Yeah, so I think that's an interesting point, and that's why I think there are a range of there are a range of reasons why people don't want to have vaccines, or why they can't have vaccines. It's because some cases due to side effects, other cases due to religious beliefs, and in other cases there are people who don't trust them or have other reasons. But I personally don't think that people should be punished for not having a vaccine. Obviously, it might lead to an increased risk of other people getting a disease, but it would also be an abuse of trust and kind of respect for those people. And I think that's why many vaccines and many drugs today, they're made in a way which kind of respects as many people as possible. Obviously, in some cases with testing on mice and that kind of thing, it isn't possible, and it's very tricky to miss out those steps. But at the same time, there are ethical considerations that many drug companies do take into account. Someone's put, what if they are healthcare workers with strong religious views? Should the vaccine be taken as a duty of care? Yeah, and that's something we will talk about in a couple of slides' time. Whether healthcare workers themselves should be able to provide treatment if they have their own religious beliefs. And personally, the law in the UK says that they don't necessarily have to do that, as long as they can still provide the treatment in some way, i.e. if someone else can provide it. But basically the religious beliefs of both patients and doctors should be respected in regards to people's treatments. I mean, personally, myself, I am religious, and I think religion is quite important to me. I'm a Hindu, and therefore I do kind of respecting animals and that kind of thing is quite important to me. I'm vegetarian, but at the same time, I would never judge anyone else if they don't share the same views as me. I would never let that affect my decision, especially, I want to be a doctor, and if I were making a medical decision, um, I wouldn't let that impact my judgment. And I think that's what doctors should do. They may have their own views, but they shouldn't let those cloud their own judgment. Someone else has put, this is where we weigh up beneficence and non-maleficence. Doing harm to society and not forming herd immunity whilst respecting their wishes or making the vaccine mandatory causes a lack of trust in the profession and potential drawbacks in the patient's community. Yeah, and trust is obviously something which is very important and essential to the NHS, as we've said. And yeah, so I think the solution here is to try and take into account these religious beliefs and try and overcome them by not using beef and pork products, for example. But yeah, it is kind of like you said, the kind of weighing up non-maleficence and beneficence, which is not always easy, but generally people try and take into account the views of as many people as possible. Sudan, do you have any more comments here? No? Okay, so I think we'll move on. I know we're already at 46 minutes, so we're nearing the end now. But we're going to talk a bit about the Amish as well, which again is a traditional Christian community. I'm sure some of you will have heard of this group as well. And they mostly exist in the USA, and they're descended from settlers from Switzerland. And the Amish generally do not allow heart transplants, as again, the heart is viewed as the soul of the body. And many people rely on folk remedies and kind of alternative medicines as well, rather than modern treatments. And this is again to do with the fact that some people consider treating people using modern medicine as kind of playing God, and they believe that it's God's responsibility to heal people, not humans. And again, that's due to various interpretations of the Bible. And the Amish do not use contraception. They often have limited prenatal care. And also many, inbreeding is also a kind of issue that exists within their community. And as a result, certain hereditary conditions, including dwarfism, are quite common in these communities due to kind of the limitation of the gene pool. And therefore, we've got a question here: can communities like the Amish coexist with modern medicine? And I think what I mean here is, is it the doctor's responsibility to force modern medicine on these communities when they have their own very strict kind of rules surrounding them and not using them? Is it a breach of a doctor's responsibility towards these people, or is it the Amish's responsibility to kind of accept these treatments? So what do people think here? Do you think that it's important to kind of preserve tradition? I know this kind of links to some of the examples you've had before, but do people, what do you think about this? And we have talked, a lot in this session about autonomy and how, and generally the consensus has been that we should respect patients' autonomy, even if it means risking their beneficence. As someone's put in the chat, absolutely not, because it's the patient's decision whether they want treatment. Consent is very important, and if they don't agree with Western modern medicine, it shouldn't be forced. Right, that's interesting. But yeah, and although some people might argue that it's possibly unethical to live in this community where you're not accepting these treatments and kind of potentially risking your own life or potentially not accepting treatment which could help you have a better quality of life, you've got to remember, as you've said, that's a breach of their own personal views and traditions, and that's not something which is accepted in modern medicine. Yeah, as you said, forcing treatment would breach coercion. yeah, does anyone have any points? Then do you have any comments you'd like to add here?
No, I think it's just really important to reiterate that it's very important to accept all people's beliefs and just respect everyone has a different belief and a right to a different belief. Yeah, that's all I'd like to add.
Yeah, okay. Um,
Some people have said something in the chat. Sorry, Shabazz, if
oh
you want to
yes.
talk about that.
All right, we've got quite a few. Yeah, they may be unaware of the benefits of modern medicine. They should be informed at least for their own benefit. Yeah, that's interesting because we've many Amish people do live very isolated lives, as in they generally are very traditional and cut off from the rest of society. You can see in this picture, they often have very traditional ways of dressing and transport and that kind of thing. Um, but yeah, perhaps you could argue that it's a doctor's duty to make those options available to them, and then they can choose whether they want to accept that treatment or not. Um, but it kind of links to the idea of there are still uncontacted tribes in the Amazon, for example, who are completely isolated from the rest of the world. And the general consensus among the rest of society is that we should leave them as they are and not communicate with them. Although, if we did, and if we did kind of, civilize them, I say that in a kind of, because it's not really respecting their own cultures and traditions, is it? Because if we're kind of forcing our own society on them, even though that society could lead them to better healthcare, and an improvement in their quality of life. Um, so, it's a tricky ethical dilemma, but generally people think that if people have their own ways of life and their own ways of their own cultures and traditions, those should be respected and left alone. Um, even if the alternatives could scientifically lead them to a better quality of life. Um, and someone else has put, should the views of people in unhealthy cults be accepted? That's, yeah, an interesting question. As easily as people with worldwide religions in terms of treatments. Yeah, different people will have different views on this. And that's the interesting thing about our society. There are people with different views, and that's why autonomy is so important, because people don't agree on what's best for them. Different people have different opinions on what beneficence is, or what is best for themselves, and what kind of treatment they want. Um, and that's why I personally don't believe that people should be forced to have a treatment. All options should be kind of made available to people, but they should be able to choose for themselves. Um, yeah, and that's what people are kind of saying in the chat. Even if their decision may lead to unfavorable outcomes, it should still be respected. Um, yeah, views should be respected, however, they may simply be unaware. Yeah, and that kind of links to the example we had about the person who wanted to pray rather than accept antibiotics. I think awareness is important, but at the same time, respecting autonomy is kind of, that's kind of what doctors should base their decision on. Right, Sidan, I wonder if we should move on. We don't have too long left, so
Yeah,
maybe
let's move on.
should we go through this one, or
I think
yeah.
let's move on. Yeah,
Um,
let's move on. I think we don't really have enough time left for this
yeah,
one.
I'll just maybe really quickly. This example is about the fact that in certain cultures, men are seen as kind of um, the breadwinners of the family, and are kind of more favorable to some couples than women are, than girls are, and therefore sometimes terminating a pregnancy when it's a girl is common in some cultures. And of course, this might be considered unethical by Western standards or by UK and NHS standards. Um, should we therefore respect people who have different beliefs to us? But it's similar to what we've talked about before. That's essentially what this case study is about. But yeah, it's similar to what we've discussed before. So I think we'll move on. Sinan, do you want to perhaps take this slide then?
Yeah, so we're just going to talk about the final thing is just what the GMC says, and the GMC is of course the General Medical Council. And this recognizes the importance of medical professionals acknowledging a patient's culture or religion. They state that spirituality can be valuable to patients' mental health, which we've discussed. Religion is a protected characteristic according to the UK Equality Act of 2010, and therefore doctors cannot discriminate or refuse treatment based on a patient's religion. I highly recommend you read the UK Equality Act of 2010 because it does talk about all the protected characteristics. Sorry, I can't pronounce all of the UK protected characteristics, and it's really important as a medical student and as a doctor to be aware of these. The GMC also states that personal beliefs and religion are central to the lives of many doctors, and as such, doctors should not be prevented from acting in line with their beliefs. Doctors do not have to perform abortions, perform blood transfusions, or provide certain medications if it goes against their beliefs. Other willing staff will instead. You have to realize that doctors are patients, doctors are people too, and they might have religious beliefs on their own. So it's not necessary for them to perform things that they might not be willing to do, maybe for ethical or religious reasons. Is it ethical for doctors to refuse to carry out a medical procedure if it goes against their religious beliefs? I mean, if you guys want to put your answers in the chat, you can, but I think it's fairly straightforward that it's not ethical to make anyone, regardless of who they are, do anything that they don't want to, or if they believe that it is unethical. So it's quite important to familiarize yourself with the GMC guidelines, the good practice, and the UK Equality Act of 2010.
Yeah, and I guess the main arguments, against this to say that it perhaps isn't ethical is the fact that if a doctor it's perhaps a doctor's duty to provide healthcare to patients. And when we looked at which topic was it? I think when we talked about the role of a doctor, I can't quite remember. I think it was when we did what do you call it? When we did consequentialism and deontology, I think it was. In that session, we talked about the role of a doctor and whether it's right for doctors to refuse to carry out a procedure if it goes against their beliefs. And also when we did futility as well, it's something that we looked at. And many people would argue that it's doctor's duty to therefore help people in whatever way possible. But I personally don't think that's the role of a doctor. I think a role of a doctor is to help people when they're willing to be helped, when they are aware of all the possible courses of treatment, and therefore a doctor, it's their role to help a patient carry out a choice of treatment that the patient has decided on themselves. And
Sorry, just wanted to add, Shiva, someone's
yeah,
actually said that I believe it is ethical for doctors to refuse if they're not comfortable. And I think Shivas is absolutely right. It's the point of a doctor, the job of a doctor is to be able to help people when they think it's ethical. Because again, that comes into their job description. And I completely agree that is completely unethical for anyone to force doctors to do anything. And the only ethical thing is for doctors to only do what they believe is ethical and correct.
yeah, and I think that a doctor refusing to treat a patient doesn't go against their code of care towards them, because if they are able to provide, if they're able to ask another healthcare professional to help them instead, or if they're able to provide an alternative course of treatment which is effective, then I don't think that is breaching their role. And as Sinan said, doctors are also human and have their own beliefs. And just as patients' beliefs should be respected, so should doctors. Yeah, I wonder if anyone has any final comments on this. We're nearly out of time, but this is the last kind of slide. So yeah. Yeah, so we put the doctor uncomfortable with the treatment increases the risks imposed on the patient. Yeah, that's an interesting point. Yeah, you could argue, especially perhaps with surgery, for example, if the doctor is uncomfortable performing surgery for whatever reason, then perhaps that increases the possibility of risks on the patient. And also, if a doctor is uncomfortable with providing a certain course of treatment, they might subconsciously kind of not advocate that treatment, or kind of subconsciously persuade the patient to not carry out that course of treatment. And therefore, it's important that doctors try and remain neutral, but where they can't, then they shouldn't be forced to carry out these treatments. Someone's put, what about doctors' beliefs with respect to contraceptives and youth? Yeah, that's an interesting point. I personally don't know the guidelines here, but I don't think a doctor should advocate something which is, if a doctor doesn't believe in contraception, in the use of contraception, they shouldn't express that to their patients. They should just tell them that there is contraception available, and if they wish to use it, or if it's effective, then it could be a possibility for a course of treatment for them. Remember, a doctor's duty is about the patient, not the doctor themselves, and therefore their decision shouldn't cloud the information they provide. A doctor should remain neutral. They should just provide the information, make everything clear to the patient, and the patient should make that decision themselves, even if the doctor doesn't believe in it. Yeah, so someone's put, sorry, my phone has just gone off. Someone's put, what if the other doctor isn't able to, e.g. hasn't got the same level of experience or knowledge? I don't know what would happen here. It's quite an unlikely situation, I think, but, I guess it would depend on the situation. Yeah, we've got some people saying minors often have limited access to healthcare, not able to see multiple doctors. How could that impact the younger patients? Yeah, and also you could argue, for example, that GP, you probably only have one GP that you would visit. If they have certain views, could that possibly have a different outcome for your healthcare? Could that cloud the kind of healthcare you're receiving? But it's tricky, and it would depend on a case-by-case basis. Right, so I think we are going to end there because we are out of time. But thank you everyone for your discussion. I think generally we've agreed that autonomy is something which is really important and should be respected, and that is the same for both doctors and patients. Their religious views should be respected, and even when that comes into conflict with beneficence and the best outcome for their patient and non-maleficence as well. But it's an ongoing debate and an ongoing discussion. But I think it's very interesting to read in the news where patients have refused treatment or they have different courses of treatment due to their religion. But if you're looking to become a doctor, then I think it's important to keep this in mind as you go through medical school and as you carry on with your training, to keep a clear mind and kind of be accepting of everyone, even if you have your own personal beliefs, which everyone, of course, does. But yeah, thank you very much. I'll just move. Oh yeah, sorry, don't worry about that. But yeah, if you have any questions, please do contact us on our email or our Instagram, which is here. Do DM us if you want to ask us questions as well. And please do follow us on Instagram if you want to keep up to date with our future sessions. We always do post a couple of slides from the session as well there. Yeah, thank you very much. Sinan, do you have anything to add?
No, thank you everyone for coming. And also, if you guys want to share the link out to any of your friends and, tell anyone to join you, or if anyone asks, if you're doing something for your medical application, you want other people to come, please go ahead, send the link. Please get them to come. We'd love to have more people. And yeah, the more the merrier. But see you guys next week. No, you can mention these webinars in your interview. Actually, we'd be honored if you did that. That's completely fine. We'd be happy for you to do that. Good luck, by the way.
Thank you, everyone.
Oh, and I forgot to say this, but well done to anyone who got into Oxbridge. I know that the offers came out the last week, so really well done to anyone did. Yeah, so really well done, everyone. And see you guys next week. Okay, Jehovahs, quickly, just